Despite many thinking the crisis is over, each year tens of thousands of people in the United States are diagnosed with HIV. Today there are effective medicines and preventatives to combat it. And here to offer new data and insight as well as recent advancements is Dr. John Van Wyk. Good morning, sir, the Chief Medical Officer at ViiV Healthcare. How are you doing this morning?
Good morning. I'm great, thanks. And thanks for having me.
That's a pleasure. Obviously a very important subject. It's sometimes very difficult for people to talk about this, but how has the US HIV epidemic evolved over the past decade?
Yes, unfortunately, most people nowadays think that the HIV epidemic is something of the past, but that's just not true. Globally, we have more than 40 million people living with HIV today. In the US, that number is 1.2 million. I mean, in Las Vegas, where you are, there's more than 11,000 people living with HIV. And not only that, we still see thousands of new infections occurring every year. In the US last year, it was 38,000. That's 4 new infections every hour. So the HIV epidemic is not over. And there's still a lot of work to do as we work towards ending the HIV epidemic.
Yeah, you talked about the number of cases here in the Valley in Las Vegas and the number every hour and every day that you guys are seeing. So preventatives are obviously very important. So what are ways that we can prevent HIV and what role is medicine playing to try and end the epidemic?
Yes, so HIV prevention is extremely important as one of the tools that we have in our kit to end the epidemic. I would say the most important thing for your viewers to take away from this is know your own HIV status. So definitely speak to a healthcare professional, go for an HIV test, and whatever the result is, act accordingly. If the result is positive, there are many highly effective HIV therapies available today, including 1 tablet a day up to long-acting injectable therapies. And that is important because not only for your own health, of course, but also if you're on effective therapy, you cannot pass the virus on to anybody else. And that's called U equals U. So a very important concept as part of HIV. I would also say that, with regards to PrEP itself, there are options. There are daily oral regimens. There's long-acting injectables. My company is called ViiV Healthcare, and we only do HIV treatment and prevention medications. And we're the first company to have brought a long-acting injectable PrEP option to the market, which is available now.
Yeah,
it's called Apretude. Yeah.
Yeah, with that in mind, I mean, obviously you guys are a part of the recent advancements in prevention research. Yeah. So what kind of things can people be made aware of in terms of what you were just discussing with preventative medicine?
Yes. This drug is called Apretude or cabotegravir. It's a medication you give as an injection once every 2 months. And to your question, importantly, as with any medication, there can be potential side effects, of course. As an injection, you can have injection site-related events like pain or swelling or redness at the site of the injection, but usually this only lasts a few days. The other important thing to know about injectable PrEP options, because there's more than one option available today, is that if you do get an HIV infection while using this medication, which happens very rarely, but if it does happen, you can develop resistance to the medication, which means you can't use it as a treatment option in the future. And then some other potential effects can be allergic reactions or liver events. More information and all of the safety information for this product can be found at a website called apretude.com.
Yeah, Dr. Van Wyk, thank you so much for your time this morning. A very important subject, and we're really thrilled you spent some time with us this morning.
Thank you. Have a good day.
You too. If you'd like to find out more information on the company, treatment, and their research, visit apretude.com.